Hi, I'm Meg Murray. I'm a licensed clinical social worker, and I am in family medicine is where my office is. So I do all mental health, behavioral health, and I specialize in substance abuse. I work with the addictions population. Mental health is the well-being of the social aspect, the emotional aspect, and the psychological aspects of our lives. And I think one reason that we've seen an increase on the awareness of it is years and years and years of effort to reduce stigma, for one thing. So I think that helps a lot. Also, if we can give credit to the pandemic for anything, right, it has increased awareness because families spent a lot more time at home, working from home, school was from home, and I think that it just gave everybody a more clear picture of how we're really doing. And yes, the pandemic did also exacerbate some of those situations as well, but it did help raise an awareness, and it did get people reaching out for help. Come straight to a mental health provider. I do get a lot of referrals from our PCPs here, primary care providers here, because typically a lot of people wait until they talk to their provider or their provider asks a few questions, or maybe they take a screening. Most providers now give us the opportunity to do a depression screening, and we may see a few ticks up on the increase in that. So, but the time to seek some help from a behavioral health specialist is, it can be as simple as even your children having struggles at school and you feel a little anxious about that or not quite sure what to do with that. If you're having marital issues, if your parents are having marital issues, you do not have to wait until it's crisis mode. I hear people say, I didn't think that I needed to come to behavioral health, and what I find that they're typically saying is, I didn't think that my problems were bad enough because it's not like I have severe trauma. It's not like I have substance abuse issues. It's not like I hear all of these things. So please don't wait until you're nearly into a crisis or you find that your life is all but overwhelming all of the time. So, a slump or down on your luck, that usually lasts maybe a week or two. You may not feel you're quite yourself or bounce back. Couple weeks to a month. If you have suffered loss, that is an event that you're supposed to not feel well for a week or two or a month or 3. But I think we need to pay attention to how are we functioning in our daily activities, work-related, social-related. How are you doing at home in relationships? How are you doing? Are you not going to activities in the community that you normally would? Are you not going to church? Are you not going to your weekly girls hangout? Are you not going to play golf with the guys like you normally do? So when it starts pushing into a month or more than that, it's time to come get an assessment, come get a screening. I literally have done assessments on people where it's not that they wouldn't benefit from therapy, but it's not that they meet criteria for a disorder. So yes, I have assessed people where I'm like, what you're going through right now after the loss of your father is perfectly normal. If you would like to pursue some counseling, I'm open for that. You do not meet criteria for depressive disorder, anxiety disorder, and so on. So sure. It's okay to not be okay. I get that. It's okay to not be okay on a regular. It does have a mixed message, doesn't it? So it is okay to not be okay. It's okay to reach it. It's okay to talk to somebody, a friend, a counselor at your church, a counselor in your office. It's okay to reach out for help. It's not okay to not be okay for a long period of time without getting somebody's attention, right? Without doing something smart for yourself and some self-care. Group therapy is a whole different dynamic than individual therapy, and one of the things I like about group therapy is you kind of understand I'm not the only one. Oh, me too, me too. I see that a lot in the dynamics in the groups that I facilitated over the years. And in group therapy, it's a little different because the facilitator typically sort of lets the group move in a particular guided direction, but you do get group member feedback. So they call each other out, they're supportive of one another. It's really a very neat and interesting dynamic. Individual therapy, the therapist focuses on you and you alone, right? And not what the group dynamic is. So the benefits of individual therapy is that you get the individual time. It is very pointed, right, at exactly what you are going through and what you feel your next steps need to be. So first, let me banish the myth that a therapist can put you on medications. Therapists, licensed clinical social workers, licensed mental health counselors, and all of us, we do not prescribe. We cannot prescribe. That's out of our scope of practice. Can we, when we feel it beneficial, recommend that maybe you have a conversation with your primary care provider about medication support? Yes, we can do that. There are so many options before we ever get to recommending that conversation with your PCP. A lot of it is, as I like to tell my clients, and most people don't realize that they can think about their thinking. A lot of people have thoughts that are negative, that are based on a belief or stemming from something that's not exactly accurate. So one of the things that we do in therapy is we do think about our thinking, but we also look at things that would help us, as we have heard our whole lives. Some of us, we hear it and it just kind of rolls off of us like water on a duck. What we feed our bodies is fuel. And so if we're not feeding our machine the correct kind of fuel, it has an overall impact on our mood, our energy level, all of that. So nutrition is really important, as well as physical activity and as well as social engagement. I don't care if you're on a bowling league or you go to church or a small group or something like that. All of those components kind of make us who we are and how we live. So those are the things that are really important to grab a hold of and keep doing. Changes in behavior, including even change in tone of voice. When you ask somebody, hey, how's it going? How you doing? I'm good. That, you know what I mean? If that's not their normal, the way that they tell. Sometimes it's a very subtle change. Sometimes they, most of the time, what I notice with people is they pull away from their normal engagement level. Not that everybody shouldn't and does need a day or two to kind of recharge your batteries. If it's typical for you every other weekend or so, just to kind of hide away in your room or in your family room and keep your yoga pants on and Netflix all day long, if that's your normal, okay. But if you do that every chance you get an opportunity to be with anybody else and you pick isolation, things like that, changes in behavior, changes in diet, changes in this person typically drinks maybe a glass of wine every once in a while, and now I notice it reaching them for something other than a glass of water, something like that, a little more often. So subtle and overt changes in behavior, definitely things that we need to pay attention to. We do have a county hospital, and it's wonderful because we have our primary care providers literally in the same building with our hospital, right, and our emergency department and our x-ray technicians and all of that sort of stuff. It's all in one building. And so when they come here to see as their primary care, or you come to see your therapist, you can schedule at the same time. You can stagger your schedule. We have people that are very good and very supportive of helping our patients get their care taken care of in one day, right? So we can do that. It's also really important because I literally, since I'm in family med, it happens fairly often that if I have a patient in my office who has a question about their medication or a side effect of their medication or any issue whatsoever that I know is out of my scope of practice and I need to talk to that provider, I excuse myself and I go tap on their door and I talk to that provider. That's worth everything to be able to immediately collaborate, much less collaborate an hour later or run into them in the hallway and, hey, I need a brief conversation with you about one of our patients that we share. That's immeasurable. It's an immeasurable benefit to have that collaboration face to face. Don't wait. Don't wait. If you're feeling out of sorts, don't second guess yourself thinking, well, my issues aren't as bad as so-and-so's, or I'm not going through what I know that person is going through, so, I'm probably not going to go talk to a therapist. You are the best person to take care of you. And if you're not feeling your best, and if you feel like you're a little bit out of sorts, you deserve to go in, have an assessment, have a conversation, right? Maybe it's time for you to talk to someone on a more professional level because we're objective. We're not emotionally involved with you. We are detached in a professional manner to a degree. So it's really good to get an objective point of view.